Hi, this is Megan from Tactus Therapy, and I want to give you a quick video tour of everything Tactus Therapy has to offer for speech-language pathologists and speech therapists around the world. First, I'm going to show you our website. There are so many great resources on the Tactus Therapy website, so just go to tactustherapy.com where you can begin learning about what we do and what we have to offer. If you're a speech professional, you can click on our professionals page to learn about how the apps can help you make your life easier. On this page, you'll find our easy 3-step way to get started. First, you use the Tactus App Finder to answer a few questions. Then you download the apps that are recommended to you, many of which have free light apps that you can try, and then you start using them with your clients to save time and get faster results. There's also a free download on this page to 15 evidence-based treatments for improving verbal expression in aphasia. So grab your free copy of this, and then you can also head over to our Learn section, where in the downloads, you'll find all of our most popular free downloads, like that guide, as well as handouts that you can use for your clients, a list of the best speech therapy apps, and a new ebook on setting goals in aphasia therapy. A lot of our articles have to do with teaching you how to do different evidence-based treatments, and those articles all have little summaries that you can download and print out. So you'll see lots of different resources here. We're also adding more and more app user guides and tips to the site to give you step-by-step instructions on how to use the apps and get the most out of them, as well as handouts for our What Is article series. These are things that you can print out and give to your patients to explain what is left neglect, what is apraxia of speech, what is fluent aphasia. And finally, there's a Using Apps to Treat section where there are summaries of how you can use each of our apps to work on talking, listening, reading, writing, and cognitive communication. And some of our other articles also have free downloads for you. So take a look here. This is one of the most popular sections on our site. Under apps, you can find all of the apps that we have. And if you're not in the US, you can just click to change your currency to Euro, Australian dollar, British pounds, Canadian dollars, and you'll see the price there. Let's take a look at the App Finder. So the App Finder is a tool that you can use. It's kind of a wizard or a quiz to answer some questions about what apps you're looking for. So if you're looking to build your professional toolbox, you can pick this second one, hit Next, and then choose your work setting. And then the App Finder will recommend the best apps for that setting. So you can have them emailed to you or just take a look. So for rehab, we recommend our best-selling Language Therapy 4-in-1, which is our most popular app, Advanced Language Therapy, which takes that app to the next level, apraxia, category. Actually, all of the apps are great for rehab, so I highly recommend getting all of them, which you can do through an app bundle. So we do have all of our apps in bundles that offer you additional savings. If you have a client in mind, use that App Finder to find apps for a particular client, and then you can answer what you want to improve, like understanding, talking, and reading. Tell us how bad the problem is. And then you'll get recommendations for the individual client. So here at Language Therapy, Advanced Comprehension, and Apraxia. Also category therapy if you want extra help. On our website, we have a searchable database, so if there's something you're looking for in particular, maybe you remember that there was something good about word finding, you can type that in and find the article really easily. And we also have information on the site down here at the bottom if you just want an app brochure to give to your clients. So you can download the app brochure in your currency and print that out. All of the prices and all of the apps. So that's everything on the Tactus website. There's actually so much more, but take a look, tactustherapy.com, and follow us on social media as we highlight some of the exciting new downloads, new articles, and new sections of the website. Now I want to take a quick look at the apps themselves. There are lots of different Tactus Therapy titles. Several of them have free light apps that you can download to check out a limited sample of what's in the app. And all of the apps are available individually. But some of our most popular apps, like the language and advanced language apps, we have bundled together into Language Therapy 4-in-1 and Advanced Language Therapy 4-in-1. So you'll see this app costs a little bit more, but it includes 4 full apps, or you can buy them individually if you just need a couple. So let's take a quick look. Comprehension Therapy works on single word, listening, and reading. You're given your settings so we can change the difficulty, the number of choices, and select which categories of verbs, adjectives, or nouns we want to work on. So let's look at all the nouns.
Mouth, theater, cat, vacation.
So because I got 3 in a row right, I'm now given 4 options. So it's automatically adjusting the difficulty. And if I get something wrong,
vacation,
I hear it and get to try again.
game.
There are hints built into most of our apps, and these are cues that the client can use to cue themselves. So here we have the written word to support the listening. We can hit repeat.
Game.
Game. Which one of these is a game? So here, when I'm using this with a client, I'm not only looking at their comprehension, which is what the app is telling me and keeping score on, but I'm also looking at how well they scan the screen. Do they choose the wrong option twice?
Bat. Bat.
Do they keep going
Bat.
for it? Do they notice the hint? Do they use the hint?
Bat.
And this tells me a lot about their self-awareness, their cognitive skills, and how well they're learning.
Mask.
Oh, I didn't do so well, so now it's decreased the difficulty back to 3 items for me. I can record myself on screen. Mask. Mask. And hear that played back. If you want to add to the task, you can have your client attempt to name the other things that they see on the screen. And when you're all done, you hit home, or when you get to the end of your exercises, you'll see your results and a recommendation, and then you can email those results and audio recordings or view the report. And from that view report, you can then share by email or saving to your files, lots of different ways to store this information. But the data is not stored in the app. We keep the apps completely private so that there are no names, no scores associated with it, so you can use it without fear of violating any healthcare privacy rules. Send the results to yourself, use them as you want, put them in your charting. Now, there's other activities here that I'll let you download the free light version of Language Therapy to play with to see how read and listen and read work. They're very similar. Naming Therapy is one of our most popular apps. Naming Therapy includes a cueing hierarchy. So you can go into the naming practice activity, choose the number of trials, the number of syllables. So for somebody with some apraxia, maybe we want to eliminate the longer words, and which cues they're going to use. And again, choose your categories. Now here I want to highlight one of our most powerful features, which is to add your own words. So you can add a new category, like somebody's family. And then you can choose an image or take a photo. So I'm gonna pick this photo of the dog. Let's say the dog's name is Rover. And I'm gonna record that. Rover. Rover has 2 syllables. My dog. My dog's name is And then some questions that I might ask about a dog, like what it does, how big it is, what does it look like, what does it sound like, and where does it live. Okay, so now we've got a custom item, and we can go back and we can include that in our practice. Okay, so our practice is going to look like this, where we see a picture and we get cues at the bottom.
The front of the head.
It's the face, and when you get it right, you hit correct. And these are nuts, and if I can say that, I hit it correct. And you'll see there's lots of different pictures here. And there are
They
lots
celebrated her 5th
birthday.
birthday.
So when the person gets the word correct, you mark it correct, and the app remembers which cue was used just before they got it correct. So it's keeping track of the data for you. And if you want to try your hand at saying it, desert. Use the on-screen recording, desert,
Desert.
and hit the compare button so that people can learn to judge their own productions and start scoring themselves. So these buttons at
Dry as the Sahara desert.
Now hopefully most people can repeat the word, so they'll get it right after the last cue, which gives them a feeling of success before they move on. Oh, and here we have Rover. My dog's name is Rover. So those are the cues that I just recorded, so I can now practice. When I'm done, I get my results, and I can view that report that tells me what happened for each word that I completed. And the recommendation based on that is to try a few more, because we need at least 5 scored items in order to get a recommendation. Okay? So that's one part of naming therapy. I'll let you explore the rest on your own. There's a naming test, flashcards that you can use for any purpose, all of the items,
Hamburger.
and describe that uses semantic feature analysis and phonological component analysis. In questions around a word.
What does it look like? What sound does it start with?
And then you can score this independent, min assist, or max assist based on how they do, and that will go in the score report. Okay, so that's naming therapy. Within this app, there's also reading therapy and writing therapy. So download the free light version, check those out, and let me know if you have any questions about those apps. Let's keep looking at the app line. So Advanced Language Therapy has 4 apps, again, that take comprehension, naming, reading, and writing to the next level. So this is more for moderate aphasia, whereas language therapy is more for severe to moderate aphasia. There are lots of different exercises in here that you can explore, and each exercise has a lot of different settings, different modes, field size, things that you can adjust, as well as levels to make the exercises easier or harder for people as they need them. So in this app, I really like to pick specific levels, perhaps the ones with pronouns.
He is cooking.
So he is cooking. I have to look closely and I can find the answer.
He is helped by her.
So here there's a hint, as well as repeat slowly.
He is helped by her.
So here we've got a level 8 sentence that is a bit harder.
He kisses her. He kisses her.
And if you want, you can go and adjust the settings. So you can turn off auto advance, you can adjust the speech rate, you can even hide the score from the screen if there's somebody who really fixates on that. And by turning off auto advance, that gives you time after you've answered the question to stay on this screen and discuss why some of the answers were wrong, perhaps generate a sentence to go with each picture. Lots that you can do while working in therapy. Build and follow are very similar in that you can adjust the levels, use all of the settings to really work on comprehension. I like using this app a lot with people who think their comprehension is okay, but when you get down to it and you give them the really hard directions, they start to realize, oh, maybe I am compensating by using context.
Touch the blue arrow before you touch the orange ticket and the red feather.
Oh.
Touch the blue arrow before you touch the orange ticket and the red feather.
Before. Okay. All right, so that's that type of exercise. And then also in advanced language is advanced naming that can help you get at sentence production, longer utterances, semantic concepts, verbal fluency. There's so much here. This app is just jam-packed with evidence-based therapy activities, like the Create activity that is based on verb network strengthening. So you can choose a verb set. There are 25 verb sets, each with 10 verbs specifically selected for VNest.
Let's talk about the verb design. Who might design something?
Now, if you're not familiar with VNest, go on the Tactus Therapy website and read all about it. There's also multiple choice options here.
What would they design?
And you can change the verb tense. And this will walk you through every step of the protocol. And you can see those steps at the top. One of my favorite activities is compare, because this can get really hard. I use this with a lot of people with higher level cognitive communication problems, working more on the abstract concepts, but I'll show you all of them. Some have pictures and are quite
How are these
straightforward.
alike? How are they different?
And then when we find the harder levels with words, like peace and quiet, how are they alike and different? Or more concrete things like book and magazine. So you can see there's a lot here to work with that really require specific vocabulary to be able to explain how peanuts are different from walnuts, or how a stove is different from a refrigerator. And if someone needs help, there is the hint that gives them the structure, as well as the scoring for you to indicate how much assistance they needed. The describe pictures are great for groups, all kinds of categories. Funny looking pictures that require descriptive language, problem solving, as well as insight into what people are thinking, what they might be saying, and some idioms with the answer in case you don't know them. Okay. In the final activity, generate, you're going to name items in categories. And again, we've got different options for your countdown timer. So if you're going to do a 1-minute fluency test, you can do that and say that I want to see how many they can name in 1 minute. And then the levels. So lots of different difficulty levels. Synonyms and rhymes are really hard. Concrete categories are a bit easier. And as they start to name things that fit the criteria, you can score correct, a repetition, incorrect. If you hit the wrong button, you can subtract the score. And you can also record them to analyze the responses later. Just show you some of these. Okay. And there's also 1-minute fluency tests built in with the published norms that are included in the report. So a semantic fluency test to name animals and the FAS phonemic fluency test, where you're given the rules and then you get 1 minute to count down on those. Okay, so that's advanced naming. Advanced reading has paragraphs, 1, 2, and 3 levels of paragraphs. I'll let you look through that light version. There's lots there. And advanced writing as well, 4 activities, starting with matching sounds to letters for that phonemic skill, typing, spelling words to dictation, typing out sentences that really gets people back into using the keyboard and paying attention, and then starting to generate their own written sentences and paragraphs. So I'll just show you one of these in spell. Let's work on some little words because those are hard for people.
Ones. It's warm once you get in. Ones. Said. You said you liked it.
Let's get a hint.
Said.
So you can see
For.
The hints.
He raised money for charity. For. For.
And you can see that it'll record your errors at the bottom. And this one is a homophone, so it marks it as a homophone. For. Oh, another homophone. For. There we go.
What? What did you say?
So there's all kinds of little tips and hints and scoring built in, as well as the settings. Again, we can hide the score, we can turn off auto advance. It's really a tool for you to use and adjust because it's so flexible that you can make it work for a wide variety of client. It doesn't just autoplay, it doesn't tell people exactly what to do. It requires your clinical judgment to set it up, find the right settings, and teach people the strategies that they need to use to get these skills going again on their own. These aren't just multiple choice exercises. These are all exercises that enable people to learn to self-monitor, self-cue, and self-evaluate. Now I'm going to show you some of our other apps that are really great for clinical practice. Conversation therapy is one of my favorites. You can go in and you can pick different topics like safety and problems, money and politics, the things that people really like to talk about, or stick to, food and activities that might not create such heated discussions. So here we have a topic and some questions alongside. What's going on in this picture? What does it mean to get pulled over? When have you been stopped by the police? Would you try to argue your way out of a ticket or just take the ticket quietly? And how does this woman feel in this situation? So those questions on the left-hand side of the screen are a bit easier. None of the questions can be answered with just yes or no, so they all encourage some form of more complex communication. And somebody can talk, they can gesture, they can write, lots of different ways to answer. And then on the right side, you'll find a little bit more complex questions. So if you tap the button again, you'll see that this is an inference question. The next one is a prediction question. Then we have a narration, evaluation, and brainstorming. Now, depending on who you're talking to, somebody might have a lot of feelings about this. Somebody might not have very much at all. So if it's not appropriate for the person you're talking with, then you can move on. Here's a topic of voting. Now, some people are going to be very passionate about these topics, and that's the idea. We want to get people talking about things that motivate them, things they have opinions about. It's okay if it's a little bit sensitive, if it gets them talking, and you can use that opportunity to help them with word finding or self-monitoring or whatever strategy you're working on. So this app can be used to work with aphasia, for picture description. It can be used for cognitive communication, with brainstorming and thought organization. It can be used for dysarthria, just that people have to talk clearly when they're answering these questions. And it can be used for pragmatics. If you are running a group, how do you know when you've talked too long? How do you know when what you've said has offended someone else? We can talk about antiques and cooking. There's just a wide variety of questions in here. So I like to have all of them selected, and then I just flip past to one that catches my client's eye that they want to talk about. If you are using the scoring, you can record correct, approximate, or incorrect. And I like to use these buttons not for whether their answer was correct, but whether or not they used the strategy that we're targeting. You can also run a group. It has up to 4 people. I'll just quickly show you some of the other apps, like Apraxia Therapy. I use the phrases the most.
Watch and listen.
Thank you.
Tap along.
Thank you.
It's going a little fast. I'm going to
Say
slow
it
down.
together.
Thank you.
Say it again.
Thank you.
Again.
Thank you. Thank you.
How did you do?
So this app uses a concept called video-assisted speech therapy, or speech entrainment, to allow the person to talk along with the mouth to gain independence and fluency. And then we have a question to self-rate after hearing yourself. And then you
What's
can
next?
practice individual words,
Thank you.
or you can go on to the next one. You can email again at the end with the recordings. The long words is more for people with mild apraxia of speech, to work on multisyllable words. These are all organized by the syllable structure in here and the emphasis. And also the sequences for counting to 10, days of the week, months of the year, the automatics. Category therapy is one that's really useful in treatment because there's so much you can do with it, asking people to expand. I use this a lot for cognitive communication. So we can go with abstract. I'll just pick them all.
Touch the one that goes with the others.
Fire, cactus, cloud.
Things found in nature.
Okay.
Right. These are all things found in nature. Touch the one that goes with the others. Right. These are all things made of plastic.
So again, this is one where I like to turn off the auto advance to really talk about what's going on. You can also turn off the category reinforcement so that the client has to tell you why they all go together, because they could just luck out. But then we have to figure out that these are all things made of metal.
Things made of metal.
Number Therapy is an app that can help people with aphasia who really struggle with numbers to understand, say, or type the numbers. The phone numbers are a really popular feature in this app. I'll just show you. There's all different kinds of numbers in here. Time, money, years. And under phone numbers, there's also custom phone number where you can add your own to practice saying those. And ordinals and fractions. You can mix and match or just select one item.
$16.36. 340.
So you can see how this could be used to help people with aphasia to process numbers and write them down, but can also be used for working memory for people with cognitive issues. In speaking numbers, let's just work on the teens. You have cues at the bottom.
Try to write or trace the number.
So here we're getting an automatic speech.
Fi.
The first sound.
15.
15. Okay. And for some of the numbers, it breaks down how you can say them. So if somebody masters saying 1 through 9, then it makes it a lot easier for them to put these numbers together. Okay. And the understand portion works a lot like comprehension therapy, just with numbers. So I've had people work on this who want to get better at understanding the numbers that they hear in bingo. So that's a really functional goal for them. Or to understand the phone numbers that people say on the phone, or the appointment times that their doctor gives them. Lots of really functional uses for understanding these numbers, and then you can also work on writing them on paper or use the type activity. Now, the remaining apps are the ones that are in our clinical tools bundle, and I'll tell you about those separately. Dysphagia Therapy is a really popular app for clinicians because it goes through all of the observations and impairments that you might see on your assessment. You can filter by clinical assessment, instrumental assessment, or all. And you check off what you saw. So we had some oral residue, some, delayed initiation. Whatever it is you see, go through this very carefully. And then you can find your therapy options. And this will show you which dysphagia treatment options match the impairments and observations that you had in your study, so that you'll know where you get the most bang for your buck. And then if you want to learn about something, you can touch it, learn that effortful swallow is a maneuver, here's the impairments and the observations with the ones you selected highlighted, the materials you need, the instructions to give, which cranial nerves are involved, any notes on the treatment, as well as selected references. If that's something you like, you can bookmark it, you can export it. And if you go back here and you export, we can pick that we want to do, let's see, some of these exercises or maneuvers. Yep, okay. And then we can export for the patient as a home program, send it in an email, and we have all of the instructions ready to go. Now, because this is text in an email, I can edit it, I can make adjustments specific for my client. Also in this app, there's information about how to assess each stage of the swallow, which cranial nerves are involved, and a whole section actually on cranial nerves, so that you can learn how to assess each cranial nerve, what it does, and then use those drawings for education. So here's a different view of the cranial nerves to better understand it, as well as a view of the swallow that you can use, or the head and neck that you can use to educate people about swallowing. This app works really well on your phone. So you can have it with you in the fluoro suite or while you're doing the fees to try some of these treatments right away while you still have imaging available. Alphatopics is another one of our clinical tools that has 3 tools for communication: a letter board, a topic board, and a whiteboard. So the whiteboard is here that you can easily, just start writing on or drawing. You can export, save to photos, or email the image or a PDF. You can clear it. The topics
TV, transportation,
can all be edited, so you can customize this with people's names or important things. The idea here is to narrow in on the topic that someone's trying to talk about first, if you're playing those sort of yes-no guessing games, this helps to get to the topic first, and then you can use the letter board
F R I E N D
to start spelling out the word. This is usually used for people with dysarthria who are able to approximate a word and just need to give you the first letter or two. But there's lots of settings here, such as putting the letters in order of frequency or first letter frequency if you're doing scanning. Here we've got numbers along each row, so you can easily scan, is it in column or in row 1, row 2, row 3, and then start going across. There are also, different color settings for people. So lots of different things that you can do with this app. I like that app for the ICU or for people with dysarthria, and I always have it on my phone or iPad in case I need a quick whiteboard or way to talk about things. I want to take you through our two apps specific for cognition. One is visual attention therapy and the other spaced retrieval. So visual attention therapy has a test and practice. So if we go through and do the test, let's do just this level here. And we're asking our client to find all of the C's. And then hit done. And this tells us that they missed 3 on the top left, 2 on the bottom left, and 1 on the right. So we can start to see, oh, there might be some degree of left neglect here. So you can go through the test at different levels, and then when we do practice, we're going to put a line on the left. We'll do the same level. And now we can't just hit all of the O's, we have to find them in order from left to right, top to bottom. So if we miss one, we have to go back and find it. So this really forces the person to scan all the way to the left side to find the targets. So that's something that your paper and pencil task can't do, and it can be really effective to train that scanning and raise awareness. Okay. And the spaced retrieval app is one that has an opportunity to enter 3 different targets. You're going to customize this for your client, so whatever their memory goal is. So it might be, what do you do before standing up? Put on the wheelchair brakes. It might be, who's this in this photo? And it's their grandson, Ted. So whatever the question is, you answer it. So let's put in, what is this? And we would show a picture. And then we can choose our interval type. We're going to allow it to send us notifications. So what is this? It's a chair. And then it's going to count down for 15 seconds. And during that 15 seconds, we can talk about whatever we want. We can do another task. The important part of this is that it is memory training. So we're trying to space out when the person retrieves the answer. So, okay, what is this? It's a chair. Yep. Now the app is going to double the interval and count down again. We can go back into our conversation app and we can keep talking about cutting the grass, about ethnic food like sushi. And then when it's time to ask the question again, we'll get a notification from our spaced retrieval app that will pull us back into the app so that we can score it. Oh, ask the question again. What is this? It's a chair. Okay, and now we're up to a minute. So that's how that app works. When we're done, we can email the results, which sends us what happened during the session and which intervals were correct or incorrect. Finally, let's take a look at Speech Flipbook. Speech Flipbook is an app that allows you to put together word lists, single-syllable word lists that meet any sound criteria. So let's flip by words and choose that we want words that start with bilabials. So I'm going to hit the tab to turn everything off and just turn bilabials on. I don't want any clusters. Let's see, I just want regular vowels, and maybe we'll do words that end in velars and no clusters. So now I have bilabial, vowel, oh, let's throw diphthongs in there for fun, velar words. And if I go into my settings, I can choose that I really only want CVC words. Okay, so I'm going to flip by words and hit start. So here's my first word, mock.
Mock.
I can touch the word to hear it all together.
Mock.
I can hide the word. And if I don't like that these sounds don't match the spelling, I can change that. I can even show them in IPA. So here we go, mock. The next word is meek, muck, mug, make. So you can see I have a word list now that matches the exact sound criteria I wanted. I can also flip by sounds. And if I don't like that there are non-words appearing, I can choose to only have real words. Okay, so you can do a lot with this to work on phonological awareness. I use this a lot with apraxia to work on saying individual sounds, starting with vowels and then CVs and then finally CVCs. You can also record poke. Poke.
Poke.
And then have them decide how good the word was. I've used this with dysarthria quite a bit, where I will have them say whether or not they want to re-record it, try it again, and identify what they're going to change when they do it again. Is it going to be louder, slower, crisper, so that we really build self-awareness into the use of these apps. And that is all of the Tactus Therapy apps. If you have any questions about any of these apps, please shoot me an email, visit the website. There are videos of each app on the website along with user guides. Some of the apps will have a info screen that takes you through each step. We are moving some of these to our website because you'll also find that in the settings you can touch any item and it will explain what that setting is about, as well as a rationale screen to tell you why you're working on this activity. And this little
Touch
question
the
mark
one that doesn't belong.
will tell you what you're doing on that screen. So we've tried to build in as much help as possible in the app, as well as resources to support the apps on the website. And of course, I'm always here to answer questions for you. Thank you for taking a look at the Tactus Therapy apps and website, and I hope to speak with you soon. Take care.